Hi, everybody, and welcome to today's webinar. We're going to go ahead and get started. On behalf of Collective Health, I want to thank everyone for joining today's session, delivering more value for every dollar spent on healthcare. My name is Nate Stansfield. I'm on the marketing team here at Collective Health, and I'll be kicking off today's webinar. Before we jump into today's session, there are a couple of things to note. First, you're all on mute, but we'd love to hear from you. Please direct all questions to the Q&A box at the bottom of the screen, and feel free to submit your questions at any time. Your questions will be addressed towards the end of today's event. Second, after the session, you'll see a short 2-question survey pop up. Please be sure to submit your response. Lastly, we will be recording today's session and sharing with you all afterward. And with that, I'd like to kick off by introducing you to today's special guests. We've got some of our best and brightest here today to speak to you about Collective Health. Please join me in welcoming Marianne Holt, Haleigh Tebben, and Kirk McConnell, who are here to help you learn what you'd like to know about our products, the experience, and how it all works. With that, I'm going to pass it off to Kirk, who will be moderating today's sessions. Take it away, Kirk.
Thank you very much, Nate, and thank you all for joining us today. Haleigh, Marianne, and I were talking about how to use this time over the past couple of weeks in light of the fact that December is a really important time, but also a very busy time. One of the things we felt would not be awesome was if you all just listened to a 45-minute pitch about Collective Health. So we decided to let you all control the agenda. Thank you in advance for those of you that filled out the survey about what questions that you had about Collective Health. What we're going to do is just focus on those. There are a handful of core questions that were submitted ahead of time. We'll knock through those. And then, as Nate said, we'd really encourage you to submit other questions through Zoom. We'd love to hit those as they come up. So with that, what is the plan for today? 6 big questions we want to tackle. And again, these questions really came from you all. First and foremost, Collective Health 101. A lot of you asked, well, what does Collective Health actually do? And a more pointed, what RFPs do we actually send to Collective Health? Next question we got was, which networks and programs do you work with? Next, how do you support members with complex needs? What do your clinical programs look like? Next, what impact does Collective Health make? How does Collective Health help streamline administration and reporting? And then finally, what types of employers are a good fit for Collective Health? Our goal, keep it light, keep it moving, keep it interactive, so definitely send us questions as you go. With that, let's dive in. And we're going to start with that first question. So what does Collective Health actually do? What RFPs do we send to Collective Health? Believe it or not, we're going to do this in 3 slides. We're going to keep it light. So what is it that Collective Health actually does? I'm going to take this one and pass it over to Haleigh in just a second. When thinking about what Collective Health does, I think it's really important to not make it about us and make it more about our clients and their consulting partners. What are they really trying to do? You know, especially as we enter strategy season, I'm sure these 3 themes are coming up a lot. First, how do employers and their consultants work together to really curate the programs that they work with? How can they bring together the right networks, medical, pharmacy, dental, and vision, the right point solutions? How do you mix and match all those ingredients so it is the right set of partners for you and your strategy? Step 1, how do you just curate the programs that you're working with? Step 2, how do you do that without creating some sort of Frankenstein administration mess? How do you put the right programs in place, but find a way to actually administer everything together? How do you simplify the day-to-day? How do you make sure the pieces actually come together? And finally, a third theme that we hear a lot, and probably the most important theme, is how do you actually make sure all these things actually resonate with your members? How do you make sure they are aware of what's out there? How do you make sure you can guide them to the right program at the right time? And pretty much independent of what you're trying to achieve in your next benefits year or what your strategy is, you have to find a way to do these 3 things. How do we bring together the right networks and programs? How do we make all the administration work together? And how do we make sure this actually makes an impact with our membership? You know, those 3 challenges are actually a really helpful way to think about Collective Health. What is Collective Health? We really think of it as the way that you can bring the right networks and programs together. Collective Health becomes the way to administer this whole solution in a really connected way. And probably most importantly, Collective Health is the way you engage your folks in these programs. One of the things that we hear a lot is, well, traditional BUCAs, sometimes they struggle to bring together a best-in-breed solution. Navigation advocacy programs can be really solid, but maybe they are the blue, but they're not helping with the day-to-day administration. They're not helping. A big theme that we hear a lot is we need to find a way to do these three things together. And so that's a really helpful framework to think about collective health. So let's go one step more tactical. What is collective health? First of all, we are able to work with our consulting partners and our clients to bring together the right networks, the right medical, pharmacy, dental, vision networks, and the right point solutions, and weave them all together into one system. Next, collective health actually runs the day-to-day administration. Think of us as the TPA. Think of us as the health plan. We're actually adjudicating the medical claims. But it's more than just simple plan administration. It's thinking about how do we streamline eligibility across your whole ecosystem? How do we manage billing and payments across your whole ecosystem? How do we take all the data we have across medical, pharmacy, dental, and vision and bring it all together into one connected reporting and system of insights? Bring the right pieces together, actually run the day-to-day. And finally, how do you bring that all together so it actually resonates and make an impact for members? Well, think of collective health as the digital tools that bring medical, pharmacy, dental, and vision together. The proactive alerts, reaching out to members when we think there's an opportunity for them to make a better decision. We are the phone number you call, the people you chat with when you have a question. Our member advocates are there to answer questions across your members' benefits experience. We'll talk about this in just a second, but Care Navigation, our program for managing folks with complex needs and helping them navigate their space. Think of collective health as the system designed to bring the right pieces together, really work with you to simplify day-to-day administration, and finally, really engage your members in a fundamentally better way. Last slide here, and a joke we often get is, why can't collective health just explain yourself in one slide? This is the slide. This is probably the single most important slide to understanding collective health. A question we often get is, well, who do you replace? This is a really simple way to think about it. On the left is maybe what you call the traditional approach. Well, we need a health plan or a TPA. Okay, that's one vendor. Next, well, maybe we want to upgrade the member experience. So we want an advocacy program, maybe a Quantum or an Acolyte. Okay, there's another vendor. Next, we want to bring programs together, but we also want to drive engagement in those programs. Okay, maybe that's a Castlight or an eVive or another program. And okay, maybe I need a little more than traditional health plan reporting, so we need a benefits analytics suite on top of this as well, so that's a fourth vendor. Really think of collective health as replacing all four of these things. We act as the administrator, we are the advocacy, we are the engagement hub, we are the analytics. Really think of us as a really tech-forward approach that goes from a lot of different vendors, a lot of cost, maybe less than optimal impact, to one where you have less upfront cost, fewer vendors to manage, and just more impact. You know, Haleigh, let me bring you in right now. You used to lead Mercer's West Coast H&B practice. I'm sure you spent a lot of your time thinking about RFPs. Especially as we enter RFP season, a big question we get from a lot of consultants is, what RFPs do we send to collective health? I'd love to work with you, but I just honestly don't know when I work with you. How would you coach people to think about what RFPs to send to collective health?
Yeah, Kirk, it's a question we get so often, it seems pretty basic. The way I would answer it is, first of all, you can send us any carrier or TPA RFP. But in addition, if you are thinking about navigation or engagement vendors, you should think about collective health. While we don't specifically carve those services out, our model, as you just mentioned on the slide, is really designed to generate the same or greater impact than they do, but without the need to have another vendor in the mix. So we would ask you to consider us and send it our way and see what we could do to help you out.
Yeah, I think that's a really great takeaway from this is first and foremost thinking about us as replacing the core health plan. So ASO, self-funded, TPA, or health plan RFPs, send our way. So we promise to keep it moving. What is collective health? Think of us as the health plan replacement that is also the advocacy, the engagement, the analytics all woven in. RFPs to send our way, health plan, TPA, RFPs. Let's go a little bit deeper on some of these pieces. The next most common question we got in the pre-survey was, okay, well, if you're the administrator, what networks do you work with? And programs, how does that work? So Haleigh, I'm going to pass it over to you to talk about, you have the collective health solution, but what network partners do we work with?
Yeah, Kirk, thanks. As you mentioned earlier on, obviously a key value proposition of collective health is that we really do allow you to bring together the right networks and best solutions under one platform. And so we get the question a lot, what networks do you work with? And so just wanted to put it out there very clearly. And these are the networks that we partner with today. So when you look at the medical, we're working with Anthem in California and New York, Blue Shield in California, Cigna, we're partnering with them with their Open Access Plus network, PPO and Local Plus, and Premera. On the pharmacy side, OptumRx, CVS Caremark, and Express Scripts. Dental, Delta Dental, and Guardian. And on the vision front, VSP and iMed. So obviously a broad array of partners that we're working with on that in the network space today. And then moving on, as you think about kind of how we partner with clients and consultants, really it's about bringing together the right networks and the best solutions. So when we think about that, we really think about it's not just for us, integration is not just a link to a portal. Instead, it's really about bringing together all the pieces at a much deeper and more effective level. And we think about that really in 4 steps. So first, it's about working with the clients and the consultants to really understand the population data of the client. So what is the strategy that they're trying to accomplish from a benefits perspective, and what are the needs of the employee population? So really using that information to partner and to determine what are the right programs to really meet the strategy and needs is step 1. Second, as Kirk mentioned, is we want to make sure we're taking off the operational lift. So not only are we curating the right programs and partners, we're thinking about how can we make it easier for our employer clients to manage all of that. So managing all the back-end implementation, operational, administrative complexities, thinking through things like one eligibility file coming to collective health, and then collective health parsing out that file to all the key partners. Thinking about payments, as you mentioned, Kirk. So how do we help the client not have to pay all those various partners, really take that off their plate as well. So the operational component is very important to take the heavy lift off of our clients' plates. Engagement, we'll talk a bit more about this in a little bit, but obviously as you're creating, as a benefits leader and a consultant, you're creating this amazing strategy. How do we ensure that our members actually engage? We've got clients that have 10, 20 different digital health partners in their ecosystem. How do we ensure that what you're putting in place is actually driving impact and getting members to be engaged? And we do it a couple of ways, and we'll talk a little bit more later, but one is, thinking through using our personalized recommendations through the app, through the portal, through email, or if appropriate, through a phone call from our clinical team to really ensure people are aware of the programs that best meet their needs and how to access them. Second is obviously, as members are calling and engaging with our member advocates and with our clinical team, making sure that we understand, again, the programs and solutions that are available to that employer population so we can make sure they engage with the right program at the right time. And then last but not least, as an employer, you're putting all these pieces and parts, and as a consultant, you're helping craft that strategy as well. How do we understand the impact? How do we measure it? And the fact that collective health is, again, the holistic technology platform where all of that data is integrated, we're able to help our clients track the impact of their program on engagement, member satisfaction, outcomes, and ultimately the total costs. So wanted to give you some examples on the digital health space. So again, as you think about, from our perspective, it's not just about a link, it's about a full integration. And so we really have a wide array of solutions that we work with across a huge range of categories that you can see on the right side, a number of categories that we have partnerships and integrations with. We have a few examples called out here on this slide toward the left of different partners that we actually have integrated in the platform. So you can see a lot of the key names of companies that you're probably hearing a lot from your clients, or as a client, you're getting a lot of interest or from your employees or hearing about in the marketplace. Again, as you can see, though, it's not just about having a loose link. It's about how do we integrate that from both the employer's perspective and the member's perspective. So we're showing here a couple of screenshots. One is our Compass employer and consultant reporting portal that you'll see a little bit later on, where we're actually able to, again, bring the data in and show the client and the consultant, how is this showing up in the metrics and the data and the engagement? And then you'll see on the little phone there, the app, and that's what it feels like to be a member. So again, all of these different healthcare digital tech point solutions are integrated in their experience. So they know what to use at what time and what their employer has available to them, all in the palm of their hand.
Haleigh, we're entering strategy planning season. And I think one of the themes we hear a lot is, well, it kind of feels like I have 2 extremes to choose from. I can carve everything in through one vendor, and they may not be the best programs, but it'll be easier to administer and maybe a little easier for my members to navigate. Or I could really go all in on a best of breed approach and put in an amazing suite of programs, but I've just created a Frankenstein for my admin team, and my members are so confused they don't know where to go. How do you think of collective health as kind of bridging those gaps?
Yeah, I think back to the beginning of when these point solutions really started popping up, and there's this proliferation of options coming into the market, and working with clients and looking at their data, understanding kind of how we would help them craft the right strategy to meet the needs of their employees and members. And we would really create a great strategy, but then it was like, how do we navigate this both from the employer perspective of managing all of it, and then from an employee perspective, how do you know where to go and when? And so I think about the fact that collective health was really created so we can bring those pieces together. We can help a member navigate, know what's available, know when it's available, know how to use it. And we can help take the administrative lift off the employer's plate of having to manage the relationships, the payments, the files, and all those things that come along with it. So I think we are really that technology platform that enables a best of breed solution for a client that wants to really create a strategy to meet the needs of their employees.
I really think of it as power and simplicity. I really, for the first time, power of saying, what is the right medical network? Pharmacy, dental, vision, 2, 3, 5, or a dozen point solutions. The power to put exactly the right set in place. But the simplicity to say, but it's actually never been easier to manage because it's one eligibility file. Or for my members, it's one app to use, it's one search bar, it's one number to call. And I think that power and simplicity is a really nice way to understand collective health. So we talked about at a high level what it is that we do. I think the partners and programs that we work with is an important piece as well. It was interesting that one of the top questions we got from you all in advance was, well, what about your care management programs? What about your clinical services? And I think that's a really fair question, because those of you, whether you're new to collective health or have been following us for a while, often what you hear most about is what a great member experience, what great digital tools. But do you have a clinical perspective? And I think it's a really nice moment to really kind of reintroduce how we think about our clinical approach and really dive into, well, we absolutely have a perspective. In fact, we think we have a really great perspective and a really great solution for managing members. What I want to do is walk through just a couple of highlights of that program. And it really starts with, well, when you think about helping members navigate complex needs, what do they need? What is the right way to actually think about this program? We drew a lot of inspiration from this great report from the Robert Wood Johnson Foundation last year, where the report basically dove into a really important question. What actually drives health outcomes? And they did a really smart analysis where they said, well, let's think about 4 factors. Well, there's the clinical care that you receive. Next, there are the healthy behaviors that each individual chooses to do or not do. Next, there are the social economic factors that impact them. And then third, their physical environment impacts them as well. I think we can all agree those seem like 4 pretty important drivers of health outcomes. But where this report got really interesting was they said, okay, but which of these 4 actually makes the biggest impact? What is the biggest driver of health outcomes when you look at the data? Personally, when I read the report, at first I was surprised, but then I thought about it and it made sense. They said, well, when you think about what drives health outcomes, only 20% of health outcomes is actually driven by the clinical care you receive. The single biggest driver of health outcomes are social determinants, the behaviors you choose, your social and economic conditions, your physical environment. And that feels surprising at first, but then you think about it and you're like, well, personally, that probably does make sense. My personal health is probably a little bit impacted by what my doctor tells me, but it's much more impacted by the decisions I make on an everyday basis, the food I eat, the amount I exercise, how I think about living my life. We really believe that the evidence shows that these social determinants are probably the biggest driver of health outcomes, and also the biggest need of members going through something complex and serious. And so if that's your core belief, how do you design a program around it? We looked at it and we said, well, the traditional nurse program has a place, but we wonder, is there a better way than just hiring more nurses and just keeping hiring more nurses? So we have our program called Care Navigation, and it's really built around this idea. The biggest driver of outcomes and probably the biggest need of members are social determinants of health. We absolutely address medical need as well, but we really focus on social determinants and medical need. If your program is based on that philosophy, well, your hiring should be as well. Who are the key players in our program? It is social workers. It is pharmacists. It's dietitians. People who are incredibly good at helping understand and navigate these factors. We absolutely have registered nurses and clinical support as well for the medical need, Well, we really think it's the social worker, the pharmacist, the dietitian who can make the biggest impact. So with that philosophy, how does it come to life? Well, first of all, who do we target? We target both high cost and rising risk members because we think rising risk members are probably the biggest opportunity to make an impact. How do we find those folks? Well, I'm going to resist the urge to geek out and talk in depth about our risk model and predictive analytics. We have a really great technology we've developed to help identify the right people. If you identify the people, so what if you can't engage them? We've gotten really good at both identifying and engaging those members, helping them navigate, and then have really robust tracking and reporting so we understand what's working and what's not. When you think about collective health and our approach to clinical management or care navigation, really think social determinant first, social worker pharmacist, and really good at engaging people. Just a couple of other things to talk about. And this slide, it's not rocket science, but I think it's a helpful reminder. When we think about our book of business, it's probably similar to your companies. And if you're on the consultant side, the clients that you work with. When you look at the membership, you probably have about 90% of the membership that's probably lower risk. You probably have 5% that's really high risk, and then kind of this green rising risk. And that minority, the 10% of rising risk and high risk, they're who are driving 75% of the healthcare costs. So when we think about collective health, we think about our advocacy, our digital tools as being really good at helping those lower risk members navigate their choices. And then our care navigation program really focused on the red and the green there, the high risk and the rising risk. The thing about the rising risk is those members can be tougher to find. They're on the verge of something. That's why we put so much emphasis on our analytics to begin to understand who can we anticipate will need us. So care navigation program really focused on the high risk and the rising risk. But when you find them, what's the point if you can't engage them? This is where our investment in member experience, our investment in building a relationship with members, our investment in establishing that trust early on really comes to bear. Whether it's the emphasis we put on building relationships during open enrollment, or just our member advocates who are so good at helping members along the way, or our digital tools that really help connect members to the right place at the right time, it gives us the ability to say, not only can we find these high risk and rising risk members, but we can really effectively connect with them and engage with them. And we engage with them on a huge range of topics. It's everything from our really smart gap in care reminders, where we can say, based on the claims data we have, hey, we think this is a care gap that you need to address. Maybe it's reaching out on things like site of care support. Hey, we see a PA just came through for an MRI. Can we help you find the lowest cost, highest value location near you? Maybe it's taking advantage of the awesome partners we work with. Hey, we see you have diabetes, but you're also not currently using Livongo, even though it's a great program your company's made available. Click here to actually enroll. Let's help you figure out how to get rolling on Livongo. Or it could be specifically to our care navigation program. Hey, it looks like you're going through something pretty intense. We'd love to help. Can we give you a call? The ability to have lots of different types of ways we can help our members. Sometimes, as you see here, they're emails. Sometimes they're alerts on your phone. Sometimes they're manifestations in the portal. Sometimes they're just outbound calls. Being able to be there to help. Last slide on this topic, and then I'd love to pass it over to Marianne to talk about some of the results and actually clinical impacts that we're seeing. But I think this is a helpful case study. It's a real one that really emphasizes what I think is unique about our program. So let's start at the beginning. A member called with just a simple benefits question. Hey, is there a coverage difference between a psychologist and a psychiatrist based on my benefits? Why did they call us? Well, we're the health plan. So we're who you call if you have a benefits question. It would have been real easy for a member advocate to say, oh, they both have a $10 copay. Thanks a lot. Talk to you later. But our member advocate was smart enough and the technology was there for them to say, well, that's a really good question. I can answer it, but I'm curious. Why are you looking for a psychologist or psychiatrist right now? And they're able to engage that member in a conversation and actually, while they were on the phone, transfer them to a social worker. Again, member advocates, social workers working together in concert to say, this is just a simple benefits question, but it's also an opportunity. Social worker hopped on the phone, was able to talk the member through, do a quick assessment, look at their previous interactions with us, their previous claims, actually do a GAD-7 scale assessment in the moment. How urgent did it feel? Was this something where we needed care right now? Or was it non-acute, but a pressing need to figure out? That social worker was able to kind of help the member calm down a little bit and say, okay, well, let's look at everything available to you right now. You have a great set of in-network providers. Your employer also provides Lyra. Lyra is a great program. Can I tell you about Lyra? Can I help you enroll with Lyra? In fact, hey, let's hop on the phone with Lyra right now and let's get you set up together, supported every step of the way. Once we got them connected, the social worker was really good at developing an ongoing relationship on a regular basis, reaching out to the member, setting member goals, helping understand, well, how's Lyra going? Do you help finding another provider, or is this a good follow-up for you? And then behind the scenes, a lot of tracking was happening. What engagement was going on? What follow-up was needed? What claims impact were we seeing? Reviewing it weekly at our medical rounds to make sure the right care was being delivered. And then finally follow up with that member to say, okay, good news. We've reached a lot of the care goals that we've set together. I think you're ready to graduate out of care navigation. We're absolutely here for you anytime you need us, but congratulations on making the progress. Again, a good example of engaging someone because they just knew to start with collective health. That social worker first model really recognizing the need. The ability to seamlessly integrate things like Lyra so you can take advantage of everything available to you. Then that ongoing support and tracking along the way. When you think about that approach, it's always nice to then marry it with kind of the data behind that. And so, Marianne, what I would love to do is kind of pass it over to you for this fourth question we got of, hey, what impact does collective health actually make? And Marianne, you bring an interesting perspective. So before you were at Collective Health, you were one of the benefit leaders at Salesforce, and then at Uber, and then at Lululemon. A lot of great companies that really tried to do two things: take great care of their people, but really take a kind of intellectually honest approach to what was working and what's not. And I know that you've been really instrumental in how we think about impact. So with that, let me pass it over to you.
Yeah, thanks, Kirk. And I'm really glad that this is one question that we're focused on, because it's a question that I was always asking of my partners, right? It's good for benefit leaders to understand the impact that their partners are having. I think, to start though, I think what we've seen is that collective health is a different model, right? And we're different because we're trying to make healthcare better. And to us, better means helping you get more value out of every dollar spent on your benefits investment and having more impact for you and your team, but more importantly, for your people. So, what does that really mean? Let's look at the numbers. I think these numbers will speak for themselves, but we're seeing real impact for both members and our employers. So starting with member experience, we have a 70 plus NPS, which we're really proud of as we place a big focus on the member experience and making sure that our members feel supported in their healthcare journey. And then if you look at how we're positively impacting population health, we're seeing a 6 to 10% engagement with our program partners. And this includes areas like behavioral health and chronic disease. And as an example, 10% of members followed through to utilize Lyra after we reached out to them through our personalized recommendations. We're also seeing a 39% care gap closure. And this includes breast cancer screening, diabetes, eye exam, colonoscopy, statin therapy. And 29% of these gaps in care were closed by our pharmacists, 10% through our email reminder campaigns. So really great results. And then Kirk also talked you through our care management program. And as he noted, we take a bit of a different approach with that as well, right? So we lean more heavily on our social workers in addition to pharmacists, nurses, and dietitians. And we're seeing a 2-to-1 ROI. So more recently, we did a match control study and looked at the pharmacy interventions we've been making. And it showed that we are seeing a $10 PEPM savings versus our $5 PEPM cost. So really great results. And if you think about it, this is just the results we're seeing with our pharmacy interventions. So this means the program is probably even having higher results and higher savings. And so we're really excited about these initial results. And then we're also seeing a 35% engagement rate with our care navigation team. And then last but not least, we're also having the impact on benefit teams that we were hoping to do. So based on our book of business, we're seeing a 60% reduction in benefit questions that benefit teams typically receive. And that's because we make it simple for members through our app, and we make our member advocates easily accessible through that one number they need to call.
So it's interesting. So I personally have been at Collective Health for 5 years, and I'm sure there's a number of you on this phone call that have been tracking us for a number of years as well. I think we've been on a bit of a journey from a really unique perspective and an idea that became a really unique product approach. And now I think 5 years in, we're seeing the really unique impact that that's able to make. And so things like saying, hey, when we engage point solutions, we're able to drive 6 to 10x higher engagement in those point solutions. So you actually get the impact from them. As Marianne mentioned, being able to close almost 40% of gaps in care is huge. Things like care navigation showing a strong ROI. And Marianne, you went quickly over 35% engagement, but that's, I think, a really important one to talk about. What that specifically means is for members we identify for care navigation, we are able to connect with 35% of them, build a relationship with them, work towards care goals, and be there with them until they graduate out of the program. That's huge. 1 out of every 3 people we target for the program, we effectively engage on an ongoing basis. I think this really shows the good idea to solid product to really unique impact as well. If you have questions about any of these stats, this is one of those areas where we're happy to dive deeper into in this meeting or a subsequent meeting, show you all the data behind it. We love geeking out about these numbers. You know, Marianne, I think it's a nice moment, that 60% administration lift. I think that kind of goes nicely into the fifth question we got is, hey, you talk about bringing all the pieces together for employers. How do you actually streamline administration reporting? What are the things you do to kind of lead to that 60% drop in day-to-day work? Pass it back to you, especially because you were a benefits leader at some really interesting, complex companies. And I'm sure a lot of these arrows give you a little bit of PTSD as you think about kind of what those day-to-days were like.
Yeah, thanks, Kirk. I think this is, again, another great question because, I mean, let's be real, managing benefits is hard. And as Kirk mentioned, I should know that because I did it for the past 20 years before joining Collective Health. And personally, I was always focused on how can I outsource that day-to-day work so that myself and my team could really focus on the more important things and really focus on fulfilling our benefit strategy. And I think that's the beauty with Collective Health, right? So we're already helping you with reducing the number of benefit questions that get on your plate, but we're also taking on the eligibility and invoicing for you. So instead of you having to manage multiple eligibility feeds, you simply send us one eligibility file from your benefits admin, and then we take it from there. And then with invoicing, same sort of thing. Rather than you having to deal with and manage all these different partner invoices that you typically get, the partners will send us the invoices, and we manage taking over the billing and managing the payments on your behalf. And in fact, like if you look at the numbers on the right, like we've already processed to date $3 billion in payments. And the reality is as well is that this is working. I mean, across our book of business, we've seen a 60% drop in day-to-day admin work, which is huge because then that allows your benefits team to actually do the work that they want to be doing, which is really to focus on new program implementations and fulfilling that benefit strategy. And more than that, let's talk about Collective Compass. So Collective Compass is really our data and insights products for employers and consultants. And it's my favorite part about the Collective Health experience. And one of the main reasons I actually decided to partner with Collective Health back in my days at Uber, I needed real-time insights that I was able to quickly and easily access if I ever needed to. And that's exactly what Collective Compass is, right? It's our employer portal that gives you insights across your health benefit programs. So you are easily able to see your enrollments, You're able to see claims analytics. How are your claims tracking? You can see member engagement. What are your utilization rates across your different programs? And also you can see program performance. It's simple, it's easy, and it's powerful as it allows you to understand real time what's working, what's not working, and what you need to do to make things better. Again, better meaning you're making sure and able to see real time, are you getting the most value out of every dollar you spend on your benefits investment? And are you having the most impact for your people? So this was a tool that I just absolutely loved, and it completely changed my role as a benefits leader and really improved my own credibility internally as I was able to proactively manage my benefit strategy.
Marianne, you brought up those ideas of power and simplicity again.
Yes, it's the way I would describe it. Simple and powerful. I think those are good ways to describe it.
We got a question that came in from Jeffrey French, which is, I think, a really good one, an important one to double click on. He said, wait, am I hearing you right that there's kind of one consolidated bill across? And I think this graphic, it's worth dwelling on for just a second, because what we're literally saying is you go from a world where you need to send out 15 eligibility files on a bi-weekly basis and just hope that 80% of them go through, to a world where you simply send Collective Health one eligibility file. We take over from there. On the billing side, Jeff, you're right. It's one consolidated bill that we're able to give back, but I think Haleigh has mentioned this as well. It is more than just a bill. It's actually helping to manage the payments on your behalf as well. So think of the power of consolidated billing taken one step further to say, actually, we moved the dollars on your behalf. Here's a very clear transaction record as well. So when you think about the ability to put even more programs in place, even more options for your members, but the day-to-day keeps getting simpler and simpler. And so Haleigh, I think you have the honor of the last pre-question before we fully open it up. We've talked about what we do, our partners, care navigation, impact, day-to-day administration. As we enter strategy season, whether you're one of the employers on the phone right now or one of our potential consulting partners, what type of employer should think about Collective Health?
Yeah, thanks so much, Kirk. When I think about Collective Health, I was introduced a number of years ago when Ali and Rajay came to speak with me. And it's amazing to see that in 7 years as an organization, we've gone from one location in San Francisco to obviously opening our office in Chicago, as well as our member experience center we're very proud of in Lehigh, Utah. And also bringing on 60 plus clients and over 260,000 members nationwide in 7 years. So I think it's just something for us to pause and think and reflect on how excited we are about that. We think about the kinds of clients that we work with. Obviously went through previously on a slide our network partners. So obviously we can work across the country and we have members across the country in all 50 states. But when we look at the places where we really focus on companies' headquarters, a lot is again tied back to the network partners we have and the strong discount positions and coverage that those partners have. And so if you look on this slide on the bottom right here, we are just showing the places where we have a specific focus. So thinking about the West Coast, California and Washington, we are going to be making a big push this year into what we call the mountain states of Colorado, Utah, Nevada, Arizona. Obviously in the central region, Texas and Oklahoma, the Northeast, New York, Connecticut, New Jersey, and then the Southeast, Tennessee, North Carolina, South Carolina, and Georgia. Again, extra focus in these places. We can work, though, countrywide. And I just am so proud to put this slide up. I think when I first was exposed to Collective Health, I thought, wow, that's amazing. But gosh, that's probably going to be a fit for our tech clients. And now when we look at our client base and our portfolio, we really don't have a specific industry that we focus on. And when we look at where our representation comes from, it really is diverse. And look at the names on this slide, these logos are just really companies to be proud of, really industry leading organizations that really care about the health and well-being of their members and the experience they're receiving. I mean, we've got everything from Driscoll's with agriculture, we've got Red Bull, more distribution, we've got Savers on the retail front, Ensign from healthcare, Live Nation, entertainment, Illumina, biotech. So again, a broad array, very proud of all these organizations and think they are just brands that many companies emulate to be like. And so specifically when you dig in and ask the question, so obviously we've showed you kind of geographically where we focus and the types of clients that have obviously signed up to be part of the Collective Health family. If you're thinking, specifically what are the details of the right kind of fit for Collective Health, just wanted to give some specifics here. So ideally, probably 1,000 enrolled employees and greater. Obviously, we manage self-funded medical plans, so either a client that is currently self-funded, or I would say moving self-funded. Given kind of the simplicity and the power of our model and having the one eligibility file and the consolidated billing, that's very attractive for companies that are moving into self-funding. Obviously, it can be a bit overwhelming going from being fully insured to self-funded. And so we take a lot of that lift and that extra work off the plates of our clients. And so I think those clients that are in that space are really a great fit for us. Ideally, though, even when I was in the consulting world, the idea of really creating a best-in-breed benefit strategy, and being able to unbundle and put all those specific point solutions or options that you want in place and having flexibility, but not wanting to have that Frankenstein model that you mentioned, Kirk. I think that is key to where we really fit, is those clients that really want to have that flexibility, but want to do it without all that extra challenge of having to manage it. And because we are able to bring it all into one platform and under one umbrella, and we're able to do what you talked about with driving engagement through our gaps in care reminders, clinical team, and personalized recommendations, to be able to really drive engagement. So if you're putting all these pieces and parts in place, you really want to drive engagement with them and have impact. And so clients that are focused on that kind of a strategy are a good fit. And obviously, at the end of the day, our company was founded on being able to deliver a better member experience with improved navigation from both the advocacy and the clinical perspective. So obviously key to kind of just the foundational elements of Collective Health is to really have that 70 plus NPS that Marianne showed previously. And because we have all of this in one platform, we are fully integrated. We are able to gather the data from the different partners that clients are working with. We're able to then deliver data and insights across the strategy versus having to gather data from this partner or that partner and trying to kind of weave it all together. As Marianne said, the power of being able to answer, what impact is my overall strategy making? The fact that we bring it all together in one place, we're able to answer that question and help our client partners drive insights across the entire healthcare strategy.
And so what we would love to do now is we already have a great chunk of questions. If you have anything else that you'd love to go deeper into or a question we haven't addressed, definitely let us know. Let me kind of prime the pump with a couple of questions that have come in. Haleigh, let me pass this one to you first. You mentioned you don't carve out advocacy or navigation. Do you carve out anything, or is it all or nothing?
We do not carve pieces out. Core to our value proposition is being the administrator, the third-party administrator. So we actually administer the claims and we have all of the data. And that's really important for us because we want to make sure that we can drive members to the right care at the right time and have insight to what the data is telling us. So we've chosen to have the integrated model. Obviously, from our perspective, and as Kirk shared previously, through that integrated model, we believe it's easier to manage. It has less risk for things breaking along the way. It creates a better member experience. And at the end of the day, we believe drives a lot more value at a lower cost. You're not having to pay for individual solutions. So we've chosen to go down that path and keep the platform fully integrated.
Next question, kind of on a somewhat related note, you talk about eligibility. Does Collective Health actually do the enrollment, and are you the Ben admin system? Or do you just connect to those systems? Haleigh, you're on a roll. Why don't you take that one?
Yeah, so we get this question a lot. I remember when I first met Collective Health, I thought, are you going to handle the entire enrollment? We don't actually handle the enrollment, but I think we make it a lot easier to work with different benefits administration partners. So again, that one file. So if you're working with an HRIS system like Workday, we are able to work with one file back and forth. We don't, many of the benefits administrative partners out in the market we already have worked with, we have file feeds set up with. So we don't support the annual enrollment process, but we definitely make it easy to work with. And again, through the one file. We do, though, I think, differentiate on our support from an open enrollment perspective. And again, engaging members early on and creating that trust. And that is something we didn't address specifically today, but we'd love to go in deeper later with. So I do think that we have a best-in-class approach to open enrollment and engaging members early on.
Yeah, I mean, to that point, while we are not the system you actually enroll in, our member advocates turn on during open enrollment if your folks have questions. We are a lot of the educational resources that go out. We put a big emphasis on helping people understand their plans during open enrollment. So it's there as well. Marianne, let's talk innovation. I know you love thinking about what comes next. The question is kind of what are some of the areas of innovation that Collective Health is most interested in and excited about right now? What are some of the things that you're most excited to see us do more of?
Yeah, I think the things I'm excited about are, well, one, I think, right, our program partner integration and how we leverage those relationships and integrate it all into one platform. We're doing a lot more work with our program partners because we obviously want to make sure that we have a good pulse on who those right partners are and who are going to have the right outcomes for our members. And so we're doing a lot more work around our program partner relationships and, really trying to think about, could we start having a premium tier of vendors that we see produce the right results and the right outcomes? Because again, it's going back to making sure that we're seeing the right health outcomes of our members. We're also starting to venture into and taking a look at evidence-based plan design. So same sort of vein in the sense of, right, we really want to make sure that we're driving members to the right health outcomes. And so I think we're starting to do some really great work with respect to that. And then the employer portal, I mean, I think we're just getting started, to be honest. And again, I think I mentioned, like, that's my favorite piece and part of the Collective Health experience, but we're just continuing to innovate and continue to build out that portal. So we're really making sure we're getting the right insights to those benefit teams. So again, rather than having to pull for that information actually is going to be pushed to them so they can easily access that information. So I'd say those are like the three big things that I've been really excited to see that we're continuing to innovate in.
I think you're so spot on that evidence-based plan design, especially as so many clients and consultants enter benefit design planning season. How often do you say, well, why does our benefit design that way? Well, because the evidence shows that that's the right way. We're able to do that enough, but I think it's really important. There's a couple of clinical questions. I'm going to take those next, but Haleigh, I'm going to pass you one first. Do you plan to develop additional carrier partnerships as you expand your footprint?
Absolutely. It's a very key focus area for us as an organization. I will say this year we introduced, late in the year actually, Cigna's Open Access Plus and Local Plus networks. So very excited about that. But we have a team that is continually having conversations and determining next steps for us on the network side, and definitely watch more to come there.
A couple of clinical questions. One is, you talk about kind of more of a social determinant and social worker-led model. How do people actually connect to a nurse or other clinician? I think it's important to note that the team really works cohesively together. So there might be some instances where, based on the predictive analytics or member need that we've identified, the first contact might be with a nurse. There might also be moments where the social worker is doing the initial triage or understanding, and they bring a nurse into the conversation based on the specific needs. Or it could simply be that the social worker is the quarterback for that member, but behind the scenes, the social worker is working with the nurse and the pharmacist to make sure that there's a full strategy in place. I think when we think about the social workers, the dietitians, the pharmacists, the nurses, the care coordinators, one of the things we try to do is say, hey, the sum is greater than the parts. When they all work together, that's where it becomes really, really powerful. Also, a question about ratios. Ratio is an interesting number because I think there's a belief in the industry that if you want a better program, you just hire more people. I think one of the things that we think about a lot is, well, how do you actually engage the right people in the right way? So push to a number, you could say somewhere between 1 to 6,000 to 1 to 8,000 a member to the full clinical team when you think about pharmacist, social worker, care coordinator all mixed together. But one of the things that I think is really important is going back to that engagement rate of how effectively do you actually engage folks? The fact that a third of the time, in fact, more than a third of the time that we identify someone as a candidate for care navigation, that we're able to not only reach out to them, but build that relationship and work with them on an ongoing basis, that gives us a lot of confidence that we're getting really good at engaging and working with members.
And I would add to that, Kirk, that percentage is also of the rising risk population. So we're not just focused on that high risk that's already been identified. We're focusing on the broader population, including those members that are on the verge of becoming rising risk.
Yeah, tougher to find, tougher to engage. But again, like the case example we talked about, a member advocate being savvy enough to know of, hey, why are you asking about a psychiatrist versus psychologist? That's an opportunity that maybe predictive analytics wouldn't even find. It takes a really savvy member advocate to put those pieces together. We have time for just a handful of more questions. Let me see what else has come in. You know, Haleigh, one that I think you touched on a little bit, but it's a fine one to add on. Hey, for folks that are going from fully insured to self-funded, why is it exactly that collective health makes that transition easier?
Yeah, it's interesting. It was something I hadn't really honestly thought about, Kirk, until I actually got a call from a consultant this year. We were working with them on an opportunity, and we had presented, and they said, gosh, you guys should really play more up all the work you do around consolidated billing and eligibility management for clients that are moving from fully insured to self-funded. Because think about it, if you're going from a world where you're paying one bill, it's consistent, you know what it's going to be, to a world where you've got multiple invoices to reconcile, multiple places to go, eligibility, now you've got files to all these different point solutions, dental, all these things. It is a big change. It's a lot more to manage. It's a lot more to have to navigate. And so I think we're able to help make that transition from the admin perspective of the employer and make it seem less complex and a lot more easy to manage. Even on the consolidated billing, we actually check all the invoices. So we're able to find errors, we're able to find opportunities and make sure that they are reconciling and paying their invoices appropriately. So I just think it's an easier process as that transition happens.
I think especially for finance teams, right? We talked to so many CFOs and finance teams who said, we finally got our company's finances under control. Now I have to figure out how healthcare billing works. And the fact that our consolidated billing and payments team, they're actually a bunch of kind of former accountants and a bunch of kind of former big three auditors who go in and say, hey, finance team, let's walk through exactly how this is going to work. Let's kind of do some memos if your accountants need that to make sure you know exactly how this is going to transition.
And people are actually surprised that we even pay the Kaiser bill if a client works with Kaiser, for example.
Totally. And so with that, we're getting to the top of the hour. I just wanted to kind of recap, you know, why collective health at a high level beyond the power and simplicity. Really think of it as, hey, we want to be able to put the right networks and programs in place. Next, we want to do that in a way that doesn't create Frankenstein, but actually we can simplify how we run the day-to-day. And then finally, how do you actually take great care of members so they get the questions answered, they have digital tools to bring everything together, and then things like care navigation to really help them navigate complex needs. When you do that right, that's why you see the higher program engagement that we see, the net promoter score, the gaps in care close, the real clinical ROI that we're seeing on care navigation. And that's why we are incredibly proud about the clients that have been with us not for 1 year or 2 years, but some 3 or 4 years. And they keep coming back to collective health. It's a busy season. We are so appreciative that you took a little bit of time out of your December to spend with us. If you want to continue the conversation, we'll make it easy. I'm Kirk. You can email me at kirk@collectivehealth.com. If there's any lingering questions or anything else, and I can either answer the question or point you in the right direction. Again, that's just KIRK@collectivehealth.com. You can also continue the conversation at collectivehealth.com. And at the conclusion of this webinar, you'll see a quick survey pop up in a web browser, just a couple of questions to let us know if you found this useful or not. So with that, I hope you and your families have a safe holiday season. Thank you again. Good luck as you get ready for strategy season, and we'd love to be a part of it. Thank you all.